So awkward. Okay. Hi, I'm Brynn, a certified athletic therapist who specializes in concussion recovery. And I'm with Jenna, Howe, today, who is a manual osteopathic practitioner. The reason we're doing this live session is because we wanted to share what got us into concussion and why we're creating a community for it and how it's going to benefit individuals that we've either come across or future individuals who suffer from concussions.
Yeah, exactly. And so starting with how we got into working with concussions and concussion care, it's a question that I get asked frequently. And we were just discussing this before, like when we were preparing, is the assumption that I got into treating concussions because I received a concussion or maybe a family member had had a concussion. And that is not at all actually how I got into concussions, like not even a little bit. So in 2002, I became a certified Bowen therapist, and I started working with the varsity athletes. So I also taught at the local community college. I used to teach in police foundations, the fitness and health class, and I also worked with the varsity players of that college, working with Bowen therapy and sport injuries. Just doing that kind of stuff. And so I was looking for a mentor, and this might be a longer story, but anyway, I was looking for a mentor to help me more with working with the sports injuries from a Bowen therapy perspective. I met a gentleman, I forget his name. He put me in touch with somebody called Craig Matimo, and this would have been probably February of 2003 is when I became friends with Craig Matimo. And he definitely helped me with all of the sports injuries, stingers, groin pulls, hamstrings, all the things. And I incorporated that all with my police foundations work, and with the varsity, I did some stand-in athletic therapy for sports teams as well. And I also had this student in my police foundations class, and after she graduated, she had taken a break from police foundations. She graduated, went on, did some other stuff. She contacted me later on and hired me as a personal trainer so that she could prepare for her police test. In the meantime, Craig had been on my case about working with concussions, and I just blew him off. And you know, Craig, yes. He's relentless. Yes. So he just kept going on, and I was like, I didn't care. Honestly, I mean, if I'm honest, I really didn't care that much. I wasn't personally invested in it. And I believed him that it worked, but that was about it. So my client called me and she said, I have to cancel my personal training appointment. I got a concussion on the weekend. This was about a week prior, the weekend prior. And she had been at that time, I think this was 2004 or 2005. At that time, concussions were graded. So it was a grade 1, grade 2, grade 3, grade 3 being the most severe concussion. She was considered a grade 2 concussion, headache, nausea, dizziness. She had a hard time exercising, driving, lots of fatigue. So I said to her, well, I do this therapy, and apparently it's supposed to be really good for post-concussion. I don't know. Why don't you just come to the house and I'll just do a little treatment on you. We'll see how it works. I did maybe half a treatment. For if there's any Bowen therapists who end up seeing this video, you'll know what I mean when I say half a treatment. And within about 3 hours, every single one of her symptoms was gone. I'm not lying. There's actually her testimonials on one of my websites somewhere. And then that's when I called Craig and I was like, oh, so it's concussion thing you're talking about. So that was really as simple as it was. I had a front row seat to a grade 2 concussion in a woman in her early 20s who had been suffering for about a week, disappear her symptoms within 3 hours of treatment. It was unreal. Fast forward, so that was 2005. Fast forward, I'm living in Victoria in 2011 into the 2012 year. I'm working with the Saanich Braves, Saanich Predators now. And that's where I met Brynn. So I'm going to put it over to her and how she got into working with concussions.
Yes, it's fascinating because it was actually you that introduced me to my passion for it. So at the time that we met, I was a student of the Camosun program for athletic therapy, Camosun College program in Victoria. And I was working with the Saanich Braves as their student athletic trainer. And the coach introduced me to Jenna. And when I met her, she said she specializes in concussions. And at this time, it was, I think, 2012. What we were learning was there wasn't a whole lot we could do. We could release the muscles for the neck, I think a few other smaller things, but there wasn't a whole lot on that. We learned more management of the concussion and how to get somebody back into play safely. And we had a game where a player, a 20-year-old player, got a puck to the face, dropped cold, slid across the ice into the boards. I got to him and he wasn't conscious. Eventually he came to, he went to the hospital. Turns out it was just a concussion. And I remembered Jenna. I was talking to him and he thought everything was over. He thought he was done playing hockey. I think it was October, so it was beginning of the season.
Yeah.
It was his 5th one. This is the worst he's ever felt. And I was like, it's okay. Jenna says she works with them. I'll contact her. We'll see what we can do. At this time, I had no idea what she was going to do. And she saw him, I think, 2 days after.
Yeah.
And then you saw him one more time, I think 3 or 4 days after that. I think within 7 days, he was completely symptom-free. It was crazy. I'm like, what is she doing? And then I think a month later, a 19-year-old got a concussion, his 5th as well, thought he was pretty much done. I was like, no, you just need to go see Jenna. Apparently she helps this other guy. You can get better as well. And again, same results.
Yeah. Yeah. Tried, tested, and true. I've been working with post-concussion care for just over 20 years specifically. And of course, Brynn, over 10 years now. So over 30 years of combined experience in different scenarios. In my community at the time, I didn't really see a lot of athletes. I saw a lot of really chronic cases. So I really developed my own way through working with chronic cases, whereas Brynn, as a role as an athletic therapist, got front row seat to all of the youth, immediate, acute concussions. And that has been pretty fascinating.
Yeah.
Do you want to talk about the bus? Or I'll talk about the bus.
So
I think it's great. It's amazing.
The big thing that really, I think, solidified it for me was the fact that I went to see you for a treatment.
Okay.
And then when I saw you, remember, I was 23.
Yeah.
I didn't think I had anything wrong with me. I was in the best shape of my life, student, no real stress, single. And I think I sat up from the table and I said, oh my gosh, I can see better.
Yeah.
Yeah, my focus is better. I was like, what did you do to me? And so I can only imagine what somebody with a concussion would feel like with that kind of treatment. So because of this, when I finally finished school, I got certified in Bowen therapy, and I started working with athletes on teams that would travel for games. And so we would travel away to somewhere for a hockey game, and then they would get a concussion, and then they'd have to be on a bus for 10 hours home.
Can't even imagine.
And when it first happens, most of them are nauseous, dizziness, all those kind of motion sickness symptoms get intensified on the bus. And people are loud, there's lights, there's just not a way for them to really get comfortable. So I would go and I guess I do like half a treatment, like you would say.
Not even. Didn't you just do like?
I think I did cervical, or like the BRM3,
Yeah.
upper respiratory,
and
and
the jaw.
TMJ. That was it, because they would lay down on the seats and I had to sit on one of the seats, and then I would work on their neck, and that was it.
Yeah.
And it would relieve the majority of their symptoms.
Yeah. And it was fascinating. So my mentor, I mentioned earlier, Craig, he worked predominantly with medically diagnosed college male football players for the most part. I think some soccer players, but mostly college football. When I started doing the work, it was a lot of the chronic cases. And then in Brynn's scenario that she had just talked about is that this super acute situation, right? So there's no medical clearance as it was back in Craig's day, because he started this work in 1996. I had people who they were NHL players who had like 13 concussions, or an ICU nurse who was attacked at work on one night, like crazy different cases. And I've lost my train of thought, but anyway, but my point is that there's all these situations that this therapy is the foundation of the treatment that helps these people feel better, regardless of where they're at in their concussion journey, where they're at in recovery. And it's just applicable in every scenario. And it's one of the reasons I think why we maintain so passionate about it, because it does not have to be super expensive. It's not super technical. We're not relying on technology. There's nothing wrong with technology. So I'm not saying that, but I'm saying there are ways that you can help somebody that is really just getting back to basics. It's just simple work, and it's amazing work. It just always works well. Yeah.
Yeah, I would say that majority of the time it gets rid of most symptoms, and then we're just fine-tuning for those chronic cases.
Yeah, from an osteopathic perspective, that could be a variety of things, maybe a little extracranial. I do some nerve-related work. I do some neurokinetic work for the eyes. I do level 3 neurokinetic. So there are obviously situations where we need to bring in other modalities to help get that person feeling 100%. But in both of our cases, the Bowen technique or Bowen therapy is the foundation of all of our concussion cases, and it hasn't let us down yet, I would say.
No, it has not.
Yeah.
Yeah, it's interesting because, like you said, with the cranial, the assessments for cranial, I can actually just do the Bowen, but I've assessed cranially, and I can see that shift happen from Bowen.
Yeah, it's pretty fascinating, pretty fascinating stuff.
Okay.
And in terms of creating a community, because I've worked with so many chronic cases, what I notice is there's a lot of gaps in the care model, depending on what, how I'm going to word this, maybe how they sustain their concussion and the treatment models that they're sort of going through. So there's a variety of scenarios. I've seen people where I'm the only care provider, and I've seen people where I'm one of about 7, and they're seeing 5 treatments a week. I think that's a discussion for another time. But
don't digress too much.
Yeah. But there's a general theme of people want to feel heard. They want to feel validated in their experience, but they don't necessarily want to ruminate in that experience, where a lot of concussion groups that they belong to are great, except it's really just a lot of story swapping. And that can be really helpful in some scenarios, but for other people, it's not providing as much tangible information that they can use right then and there. And that was my drive to create this concussion community so that we can provide easy to access, easy to implement, sort of tried and true strategies to help people feel better in between their treatments, filling the gaps between the treatment care that they're getting, or maybe they live in a rural community. I think, when you were living in the States, that was a huge thing.
Yeah. So I would say my whole reason for it is that in providing an opportunity for people to have access. We've realized that a lot of people don't have access to this information. A lot of it is out there, but if you don't know where to look and you don't know what you're going through or what it is that you need, you're not even sure where or how to find the information.
Yeah.
And so depending on your symptoms, it changes.
Yeah. I mean, there's six concussion subtypes, which is a newer model. Like if we're going back 20 years, that didn't exist, right? So now a lot of more conventional approaches are working on the subtypes, but we have found that there's not a lot that's tying it all in together for the uniqueness of that individual person. So if they fit more the vestibular subtype, then they're only going to be slotted into vestibular physiotherapy, but they're a whole person. And there's a bunch of other symptoms that are maybe hanging out in the background. They're not screaming for attention, but they're still there. And that's part of that piece that gets missed, is treating the person as a whole. And the community that we're creating, people have the opportunity to sort of pick and choose what they need at any one time.
Yes.
Yeah.
I lost my train of thought.
It's been a long day.
Yeah.
And we want to bring in, our goal is to create a community that brings patients and practitioners together in a welcoming, safe environment, so that people do feel heard, feel supported. Maybe they don't know anything about vestibular physiotherapy, but they have no idea where to go to even ask about it. Whereas we have a vestibular physiotherapist in the group who you could post that question and say, what does a vestibular physiotherapist even do? Where's the best place for me to go find one? Or, has anyone else ever experienced XYZ? And maybe somebody in the group has said, yeah, I've experienced that. Have you tried this? But in a contained area, so that it is that safe place where
you can share that vulnerability without judgment. Yeah,
absolutely.
I think that was the other part that I would say is knowing that the person you're dealing with is concussion informed.
Yeah,
because vestibular therapy for someone with a concussion versus somebody with I can't even remember the word of it, other things may not work for you.
Yes, here would be an example. So I had someone come to me and they were seeing a physiotherapist that was part of the concussion program. This particular individual presented as very physically strong, right? So, but didn't take into consideration that this person had to wear earphones. They had to ride the bus because they couldn't drive. Their visual system was really stressed. So auditory issues, visual issues, but physically very strong. This person was told that she was fine and she was going to get dismissed from the program because she could do a deadlift. But when she had expressed the fact that everything else around her, it was bright lights, there was music playing, there was a lot of noise, and she, sort of just burst into tears. And if you've had a concussion that has a lot of sensory overload, then you know what that feels like. And that was kind of it. Like, that was her experience. Whereas if she was somebody who, say, had dizziness, but didn't have sensory overload, those lights, those sounds, none of that would have been bothered bothersome for them.
Yeah.
And that's the difference, is that when you have somebody who's concussion informed, they can look at the intake form and go, oh, you have visual sensitivity, light sensitivity. Let us turn off the fluorescent lights for you when we do your assessment so that
Yeah.
it's more comfortable. Oh, it's loud. Let's see. Maybe we can shut the door. Let's create some barrier with your auditory sensitivity. Concussion informed doesn't have to mean you've gone to school for any big training. It's just acknowledging that that individual has a lot more going on than whether or not they have general strength. That's the point I'm trying to make there.
Yes, and that the environment isn't aggravating the symptoms. The treatment isn't making you feel worse walking out.
Yeah. Yeah. Again, it comes back to treating the individual as a whole.
Yeah.
And this community that we're creating is driven by the hundreds of people we've worked with who have been challenged by a lot of scenarios that has held back recovery or has made them really apprehensive to seek out treatment. And then they're not left with anything. So this group that we're creating is also giving those people an opportunity to be able to do something to help the recovery while they're still at home, if they're feeling like they can't go out and seek help in person.
We are having a promotion for the group. First 100 members are free, so you can find the link in the description and sign up and check out the resources that we have. We will be adding more over the next month.
Yeah, we have different categories. You can peruse through the group. You can, if you join the group, you can introduce yourself. We're creating a service directory as well, so that for the people who actually have offerings, right, rather than peppering the individuals, there's a service directory. So if you're looking for a particular kind of service, then you can go there. If you're a practitioner and you found this and you want to join our group, then you have an opportunity to post your services there. There will be a fee after the 100 members are reached. It'll be low cost, so really low barrier entry. The cost will just be enough to cover our admin costs and make sure that the group stays running. We'll be offering events, webinars, coffee chats, all sorts of things over the coming months as we build our community.
I'm looking forward to starting those new things.
Yeah. It's really exciting. We've been talking about it for a number of years.
Yes.
And now we've finally found a platform that I think really fits what it is that we're trying to do. And that part is really exciting. So I feel like that took a lot longer than it should have.
Yeah, I feel like all of it did.
Yeah.
Now we're just going for it.
Yeah, we're just going for it. So if you have any questions or comments, leave a comment. We have ways that you can contact either one of us. We have the link to the community program. Feel free to connect any way you want.
All right. Hopefully we see you soon.